Welcome to another episode of Aesthetics Unscripted. I'm your host, Kim Laudati, and I'm here today with my core medical aesthetic magician level estheticians, my core staff from IT Intelligent Treatment, Monica and Melanie, and the co-host Angel from ANJ Media. So I would love to have you both introduce yourselves because, I'm a medical aesthetic esthetician, regenerative expert in aesthetics, and so are the both of you. But Monica, why don't you tell the audience a little bit about yourself?
Sure. I'm Monica. I'm originally from Venezuela, but I've been here in the US for a little bit now. I came into aesthetics as a second career, actually. I used to work in mental health. I was a social worker, but personally, I've always loved skincare. I struggled with my own skin growing up, so I was always very much into creams and treatments and all of that. And about 6 years ago, out of curiosity, I wanted to learn more about skincare and thought it was gonna just be a hobby and just a passion project, and went into aesthetic school. But that turned into more than that, and I completely switched careers, and I've been an esthetician since. I've worked in a range of different jobs, all the way from more spa-like, more medical, and then I found the perfect mix of everything here at ITX.
Thanks. It's very funny because that mirrors my journey also with having bad skin when I was younger and second career, and also started out at the same exact starting point actually that you did.
Mm-hmm.
First out of the gate for a particular esthetician in New York City that was in between day spa and medical spa, and also did from holistic all the way up to hardcore like treat and street type of mentality with table paper medical aesthetics, and ended up circling back to bringing us to IT Intelligent Treatment where we are in between. And what we mean by in between is the luxury of day spa type of atmosphere, but really hardcore, cutting edge, the latest and the best of regenerative aesthetics. So Melanie has been with us since 2013. Can you tell us a little bit more about yourself, Melanie?
Yes. So my name is Melanie. And like you said, I've been working with you or been part of your family since 2013. My first job out of aesthetic school or an institute, we went to AE. It started a little bit kind of like Monica. I did it more as a curiosity type of thing. I was in college. I was struggling a little bit skin wise, trying to find the right product for my skin. At that point, because of midterms and final exams, I was breaking out a little bit, but my skin was always dry, and I was always using Clean and Clear, which made it even worse. And then just diving into more of what should I do for my skin because I'm a very dry human being. So just going to see what works for me. And then I went to the Institute just for more of references as to what to do. Made in a sense kind of like, again, like a little oopsie, and they're like, oh, you're interested, you want to go into school, and I'm like, no, I'm more of what products you sell and everything. And then one thing led to the other. I became a student full time, and then I was like, if anything, I'll go back to college. This is just a little 6 months period type of thing. 6 months became a full year. Took advanced courses, and then ended up at your doorstep. And since then, it's been a nice journey.
That's great. I think it's fantastic also because we're all very passionate about quality of care for the patients, but we all also share a love for lasers and all advanced aesthetics. And especially now that life sciences and biomedical is becoming huge, not just in medical aesthetics, but in medicine, I'm very, very honored and pleased to let our listeners know that not just our medical staff, because we do have doctors and of all different specialties, all the way up to plastic surgery, that work for us and with us. But for us, the core staff, we are all about continuing education, and we're always interested, curious, and seeking out as much information to move forward properly as possible. We never rest on our laurels. So to have that passion shared with both of you is fantastic, and I know it resonates with the patients.
So I guess I'll introduce myself over here. Just like, who's this random guy not in blue? My name is Angel Morton, and I am a pop culture commentator and podcaster. But I began with the beauty industry because I was a hairstylist. So when you go to beauty school, you do learn about skin and as well, but not as detailed. But as I got into social media and content creating, I noticed I geared towards med spas, beauty industry, hair salons, and stuff like that. So always being around it, I've always learned about different treatments and it always intrigued me. So I just love to film that kind of stuff. So that kind of led me to you. And we've been working together for just recent, like the past few months now. And I'm really excited to learn a little bit more and in depth about what you guys do that I don't get to see all the time.
Yeah, I think it's fantastic. Yourself and Andrew from ANJ Media, a great crew to be working with your social media, by the way. And I know there's different specialties that resonate with each therapist and doctors. You know, like every plastic surgeon I know is adept at pretty much full body plastic surgery, but they have, like any human, they have their favorites. Some excel at facial treatments, facelifts, upper blefts. Some excel at tummy tucks, liposuction, mommy makeovers. Some are great at breast reconstruction. Some can do beautiful facelifts, and they can't really do a nose job at all. So that when it comes to iridotomy, they will refer that out to someone else. So, Melanie, what's your favorite things to provide to patients?
I would say I do enjoy a good, what we call the European facial in a sense. Like, I like a good extraction. So that's my, I wouldn't necessarily say it's my specialty. I would say more it's my pleasure. Like, I like seeing a good congested face and just start going at it.
And you're great at it also.
So that's more what I like. If I have to say more, microneedling is probably a thing that I like to do as well. I just feel like I like to torture a little bit. I think
Is that
that's
what
my
it is?
thing.
Do you guys like the whole extracting aspect of it as well?
Yeah, it's very, very it gives a lot of satisfaction. It's very, definitely. Sometimes I dream about it, and it's
Listen, I watch videos about it online sometimes. I'm like, it's so gross, but I end
there's
up watching it.
something
I'm like,
about
I love that
it.
coming out.
Yeah.
Right. It is satisfying, and I love to be able to hand off the acne patients specifically to Monica and Melanie, because I'm definitely more of a regenerative, passionate type of person. So, I want to get in there with Somacell. I want to jump in there. We're all laser certified. There are certain laser treatments that the doctors on staff will perform, and then there's other treatments that will perform, from laser hair removal to Frax laser resurfacing, IPL, which is intense pulse light to treat brown spots and redness issues. So both of these ladies are great at everything. But again, although we might be passionate about something, we will excel in certain areas better than others. So that's one of the things that I'm proud to say, that, we will always converse when a new patient's coming in and who is that patient best suited to be with. Right?
Okay,
So
yeah.
we're more about that patient journey and that relationship, as opposed to you're going to see somebody new every time you come in, and it's always going to be something different and it's not what you're expecting. Melanie and Monica both with hydrofacial and your extractions, that's a fantastic combination. We're passionate about our microneedling because we don't do anything with downtime. And so when Melanie started also at a separate location,
She's laughing already.
Melanie at a separate location would do like what I call the bloody face method of microneedling. And then I was like, no, well, we're doing it this way, and these are the reasons behind it.
So what you're saying is very controversial. So can you explain a little bit about, should microneedling, when you're getting it done, should your face be that bloody or should it not? People are saying, no, it's supposed to be bloody. That means it's working, that it's penetrating deep enough. Other people are saying, like, you really shouldn't be bleeding. So what's the
Right.
truth about that?
The way it was technically created was to insert into the skin at 90 degrees, which will not draw blood and not create a bloody face. But, when Melanie is working with this other equipment that we don't have in the IT Intelligent Treatment clinic, that does usually create a bloody face, correct?
Yes.
And that is like the end point. You know, I mean, you've seen results with it though.
Yeah.
And do you usually, would you combine PRP with that, or how was that process? Was that more serums or?
We used to use the protocol that was given to us with the machine. Just to, because if it was so intense, sometimes our clients would react a little bit more or would be a little bit more sensitized with it. So we would try to keep it with whatever was we used to use with.
So you mean it was more painful?
Yeah.
Okay.
Yeah.
That's what I was going to say, so it hurt.
Well, you
Oh,
numb
yeah.
people.
You had
with
to
that
numb.
one.
Yeah. Oh, okay.
You had to numb. You cannot go doing that treatment without numbing at all.
Oh.
And sometimes, even with the numbing cream, they still feel it a lot more.
Gotcha.
So sometimes it was if they weren't coming in on time for their numbing time, we weren't able to do the treatment at all because they weren't numbed enough.
Oh, you weren't allowing them to skip that part at all? Okay.
Not at all. That was not an option. It was a late cancellation or reschedule altogether.
Oh, wow.
Yeah. With the machine that we use at our facility now in ITX, it's technically like if you were going in for a facial. You might feel a little prickly here and there, but nothing to the point that you're like, stop or anything like that. It's more of, I always say, if you don't feel a little bit, then it's, you need to feel something. But I do have to admit, you get the same results without having to do the downtime whatsoever. So we have clients or patients that literally go in, do their treatments, and go straight to whatever previous engagement they had, or if they have, back to work. We do have a good amount of clients that go back to work afterwards as well.
Okay. So the answer is it's okay to not have the blood. That's not necessary.
Absolutely.
Yeah, it's not.
And if anybody has the time to tune into our social media, where we did highlight microneedling in particular, we do talk about the reason, especially when you're using things like topical PRP. It's like oil and water. So the whole blood will block the penetration actually of the PRP on the surface. So it's actually robbing the patient of some time and money. And that's another reason why we prefer not to create a bloody face before applying those topical products, because we want that transdermal penetration. We want you to get what you're paying for. How did you feel about that, Monica, when you came on board? Because, everything we do is like pretty customized for what the patient needs on the day they walk in, but also combination treatments. It's not just like cookie cutter, cut and dried stuff.
It can be a little tricky, I will say, because oftentimes patients come in with a certain expectation, and it's a lot of education on how to achieve that. And when they have their mindset to something, it definitely can be a little bit challenging. But I think that when they see the results, their mind is completely changed. So it's great. I mean, I love stacking treatments also. I love trying different things with patients of like, oh, well, maybe I've never done this before, but we can try it and see. And then the results are great and doing that.
When a patient, like you said, comes in and specifically says, I saw this and this is what I want to do. And then you or Melanie will analyze their skin and talk more about their history with their skin reactions and their general wellness. That is definitely not the right route to go. And they do need to be educated, and they need to have that level of trust to jump in and say, okay, fine, I'm going to lay here and give you my face now.
Do you think a lot of people do not get that education before they go see a provider, or maybe misinformation?
Oh,
So this
so
way,
much.
that's why.
100%.
Oh my
Do you think that's a
God.
reason why when they come to you, they just assume they can ask for something and they'll just receive?
Well, we always get a laugh out of this. I always say to my patients, this is not bippity boppity boo. It's not that you're gonna get a treatment and it's boom right there.
Yeah.
No, some treatments or some things that you want to get done, you need time. It is an investment sometimes. I'm not gonna lie, but everything that's that deserves the time and the money, you should do it. I mean, you deserve it. You should always do it. But my thing is, especially with these social medias now, they see before and afters, but the majority of the time they don't tell you how many sessions in to get to where you want to. So they think that once you do one session, that's it. Your skin is cleared. You have no more pores. this is what made it, but what other things were you using in the process? What other things were you doing in order to do it? So majority of the time, even just reflecting to one product or to one treatment don't necessarily give you the proper information as to what it is.
It's like a tip of the iceberg. You see that little piece, but underneath there's a whole
Different, so that sometimes gets a little frustrating, especially with us when it has to do to explain it, because sometimes even when we're explaining it to our patients, it's that they don't get it either. I would say it takes a little bit of time. I would say we're gonna have a relationship, and it's going to be a love and hate relationship in a way. You're gonna hate me one day, and then you're gonna be like, you were right, and then other days you're like, why am I not there yet? But it's a process. You just have to be patient with it. Both ways has to be patient with it.
So would you say patience is the one thing that people lack sometimes that causes them to not do the right thing?
Oh yeah,
It's just like they want it right away, right?
Patience and
Immediate
communication for
results.
sure.
Yeah. Do you think when it comes to communication that people sometimes neglect to tell you something or leave something out purposely, or maybe lie about something so they can still get that process done?
Oh yeah. And when they get caught, it's like, you cheated. Stop cheating on me.
Well, I think it's important for patients to always tell us everything about
Like a
their
full
history,
disclosure.
all the disclosure, because maybe they think that if they don't say something, then maybe we can go stronger or we can go more intense, but that can
Give you even
very
worse
much,
reaction.
like that can backfire often, or most of the times if they don't disclose, like if they have an allergic reaction to something, or if, they might appear white, but then they have some background in their, family that isn't. So if they don't say these things, and because they think, maybe they'll go stronger, or they used a product the night before that's too strong, and usually you don't
Are
want
there
to
any
do
products
that.
that stops a lot of those treatments that you do if they use the night before?
Yeah.
Well,
Like what's a common one?
Prescription retinol.
Retin-A?
yeah, or if they are
Any
overly
active
exfoliate, any
ingredients.
active, like if you're coming in for a laser or even microneedling or even a facial, and you've been using a lot of exfoliation or a lot of harsh ingredients in your skin, and your skin barrier is compromised or sensitized, or you're too dry, those things can impair, like can prevent you from getting the treatment. Sometimes you don't know. When we see the skin, it might seem fine, but maybe they just did a peel last week and we don't know. And then we go in with something strong, and it definitely can backfire.
So what happens like if you discover this halfway or midway? Has that happened to any of you that you're like, you started it and then you're like, oh, wait a minute.
Oh, so many times people are like, oh yeah, by the way, I did a peel last week, and you're halfway through an IPL.
So what do you do at that point? Do you finish, or do you like not finish, or kind of just do something else to top it off?
I think it depends on the service.
Yeah.
So we'll definitely pump the brakes,
Yeah.
readjust settings. Some treatments would have to be halted completely, depending on what it is. I find for myself personally, maybe patients, especially new patients, might be a little bit more afraid to say something until afterwards to me, where they might say something during the process to both of you. So afterwards is the worst time to tell anybody anything, no matter who it is, no matter what clinic you're in, because that's how you get burned. That's how you get scarred. So it's one thing, like Monica was pointing out, Melanie were saying, if you don't know your ethnic background, it's one thing, right? You literally don't know. But if you know and you omit purposely because you did some research on Instagram or TikTok and you're like, oh, I really want this treatment, but you know what? I'm kind of not supposed to get it from what I'm reading outside of social media. I'm seeing I'm not supposed to get this. I'm just going to go lie. That's how you're going to get burnt. And we are just as traumatized, maybe sometimes even more traumatized than the person that actually would have an allergic reaction or would have a negative response. I'm happy to say that we have an extremely clean running record at IT Intelligent Treatment because we're so specific about patient education. And we have a huge intake form for your first treatment before you even come in, right? Big health history. Everything is HIPAA compliant. Everything is private. But we're really deep diving into your wants, your needs, your ethnicity, your contraindications, what's happening in your life, what's the time frame available, what's your budget, right? We're going to work this all out to make things work so you're comfortable with the journey, and we're taking you by the hand and going on that journey with you.